Well, we're going to get started. So I'm sure there are going to be a few people popping in, but we want to get started on time and get moving forward with our conference. So I'd like to welcome everybody today. My name is Carrie Schonlaw, and I am the Deputy Director over Aging and Human Services at Five County and our Area Agency on Aging Director. So again, welcome everybody today to our conference. Well, another year's gone by, and what a year it's been. From wearing masks to toilet paper shortages to social distancing to the closure of our senior centers and a lot of our in-person services, from stay at home to stay safe to stop the spread campaigns to now vaccinations. And now our senior centers and other in-person services are starting to reopen, and people are slowly starting to gather safely together again. No matter our feelings of COVID-19 and the pandemic this last year, it has truly changed all our lives in one way or another. My hope for each one of us as we look back on this year is that we not focus on the negative, the challenges, and what was lost, but what we gained and what we learned about our amazing ability to move forward in new and different ways, to discovering our resiliency and our ability to adapt and to reach outside our comfort zone, to learn new ways to engage, to set aside our fears and learn new skills, to discovering how technology can expand our reach and provide new ways to connect, not only to help ourselves, but in reaching out to help others around us. I'm looking forward, as I know you all are, to the possibility that next year we can once again meet for the 20th Annual Area Agency on Aging Five County Seniors Conference in person. But more importantly, my hope for each of you, as you listen to the presentations today and the experts and champions in the field of aging, that you look at the positive impact and the many advances that we have made in the field of aging over the past year, and how much we have come together as individuals, as professionals, as community partners, and as citizens to look at what the future will hold for all of us as a result of what we have learned and overcame, moving past the negativity to find the positive. I think about positive for me, and the thing that comes to mind out of this pandemic is I go back to a panel discussion at the opening plenary of the NCOA conference last year, when we were all just beginning this journey. The panel was asked, what could a future bring filled with hope look like for older adults? I remember responding by saying, I see many positive things that we have learned, new collaborations, new community partners, new methods of service delivery, and that we can continue to build upon that. It may have taken a pandemic for many of us, including older populations, to step outside our comfort zone, to see all that the virtual world has to offer us. We have just opened up the field of aging to a whole new world. We can never replace the intimacy of the human touch and that in-person contact, but we have learned that we can still connect no matter how far away we are. And in many ways, our ability to connect has now become endless and no longer bound by distance. I hope we can all remember, as we listen to the presenters today, remember that beauty and that promise that tomorrow may bring to all of us. Before we move into our presenters, I would like to give a shout out to our Genie level conference sponsors, AARP of Utah, CapTel by T-Mobile, Spilsbury Mortuary, and the Utah Geriatric Education Consortium. I'll now turn my time over to Kate Nance. She's a grant coordinator with Adult Protective Services in Utah, managing a grant aimed at reducing financial exploitation of the elderly and vulnerable adults in Utah. Previously worked as an attorney specializing in elder law and saw firsthand the devastating effects that financial exploitation and scams have on individuals and their families. It has been our pleasure to work with Kate on a variety of projects over the last year. She is dedicated, dependable, and always willing to lend a hand in efforts to educate older adults. We're pleased to have Kate with us today for an exciting Name That Tune activity.
Thanks so much, Kate. I don't know about everyone else, but I thought that was so much fun. So thanks for helping us boogie into the conference. All right, so we're just going to keep moving right along here. And I now have the distinct pleasure of introducing our keynote speaker. Leslie Freed is the Senior Director of the Center for Benefits Access at the National Council on Aging. As such, she advocates for improved access to Medicare, Medicaid, and SNAP, as well as other public benefits for disadvantaged older adults. She also monitors policies that enhance access to health aging programs for seniors. Prior to joining the National Council on Aging, Ms. Freed was a senior attorney with the American Bar Association Commission on Law and Aging. She joined the ABA in 1998 as an attorney for the Medicare Advocacy Project, a collaborative effort with the Alzheimer's Association. She specialized in Medicare issues and responded to Alzheimer's-related Medicare inquiries from local Alzheimer's Association chapters. From 2001 to 2003, Ms. Freed was a member of the National Academy of Social Insurance Study Panel on Medicare and Chronic Care in the 21st Century. In 2003, she was selected to be a member of the National Academy on Social Insurance, a nonpartisan organization made up of the nation's leading experts on social insurance. From 2005 to 2009, Ms. Freed was a patient advocate member for the Centers for Medicare and Medicaid Services, or CMS, Medicare Evidence Development and Coverage Advisory Committee. Ooh, that's a mouthful. She was a member of the Continuing Care Advisory Committee for the Maryland Department on Aging. Before joining the ABA, Ms. Freed was in private practice representing clients in various elder law and domestic relations matters. She was a staff attorney and then managing attorney of legal services for senior citizens of Montgomery County, Maryland, and Older Americans Act Title IIIB Legal Services Program. In 1995, the governor of Maryland appointed her as the delegate to the 1995 White House Conference on Aging. Ms. Freed received her bachelor's degree from the University of Michigan and her law degree from the University of Maryland. She is a member of the Maryland, District of Columbia, and Supreme Court bars. We have had the pleasure with working with Leslie and her team since January of 2018. During that time, we have been inspired by her passion for advocating for older adults, and we admire her leadership both within her agency and across the nation. We are excited and honored to have her here with us today. So without further ado, I'll turn the time over to you, Leslie.
Thank you. So I need to share my screen. So how do let's see, will you let me share my screen?
Yes, I've made you a co-host, so you should see the green button at the bottom that should let you
share screen, and there we go. Okay, can you see my screen?
We can.
Great. Thank you. And it's just a reminder how I have to send my short bio to folks when I present. But thank you so much, Christina and Carrie and Kate and all of you in Southern Utah. Kate, I was singing and dancing. It was a great way to start the day and a great way to learn about fraud. And Carrie, your opening remarks really convey a very similar message to my own. So good morning. We're looking back, looking forward, and it is a time of resilience. So I'm at the National Council on Aging, where our mission is to improve the lives of millions of older adults, especially those who are struggling. We've been around for more than 70 years as a national nonprofit and really focused on impacting the health and economic security of 40 million older adults by 2030. So what do these 3 years have in common? Now, if we were in person, I would ask you all to shout out the answers, but we aren't, so I won't. But for those of you who have ever lived on the East Coast in one of these years or the Midwest, you actually might know the answer. And it's brood 10 cicadas. These are once every 15-year bugs every 17-year bugs, excuse me, let me get back. That once every 17-year bugs, they come out, they are really noisy. And they're starting to come out right now. And there will be billions of cicadas that are on the ground in Eastern US and the Midwest. They have, as you can see, fire engine red eyes. And when they emerge from their tunnels underground, they are loud. They are singing. They're as loud as a lawnmower. and they look for a mate who will then lay eggs in small trees, and the nymphs will hatch and then tunnel underground again. The cicadas that we will be seeing this year were hatched in a small tree in 2004 and dropped to the ground, burrowed through, and molted and ate until they emerged 17 years later, which is right now. This is just a picture of what they will look like in our neighborhoods, on our streets. They are bugs on steroids, and they sing loudly. So you might wonder, why am I talking about these cicadas, other than I think they're very cool? But it's been said that every time the cicadas return, the human calendar has accelerated. They're like a yardstick of 17 years. So in 1987, when the cicadas emerged, AIDS was a global scourge, thought not to be survivable. Yet the first antiretroviral drug to treat it was approved. The first and very large pocket-sized mobile phone came on the market for over $3,700 a phone. Apple was mostly known as a fruit that we ate to keep the doctor away. And Tom Brady, the quarterback for New England and now Tampa Bay, was 10 years old. The next time these cicadas emerged, the avian flu crossed from birds to humans, starting a pandemic in Southeast Asia. Facebook was launched at Harvard. iPhones did not even exist. And Tom Brady had only 2 Super Bowl rings, and Janet Jackson had 1 wardrobe malfunction. And here we are 17 years later, and as the cicadas emerge, COVID-19 is a global pandemic, yet there are numerous vaccines to protect against COVID-19. iPhones are your telephone, camera, and computer all in one. The US and global economy entered and exited a great recession. We have had 4 presidents. Virtual conferences such as this one are available. And Tom Brady has earned yet another Super Bowl ring, yet with a different team. So the cicadas are an example of discipline, patience, and resilience. And this COVID year has been one of challenges and survival. And so I just wanted to go quickly through some of the data, which I think we probably all know. On the national scale, and these are all data that I pulled last week, nationally, we've had over 32 million cases of COVID-19. We've had over 571,000 deaths, but the daily death rates actually are going down. In Utah, there have been over 397,000 total cases, and the death rate has been at is now currently over 2,200. In Utah, about 37% of those hospitalized were 65 or older, and 59% were at high risk. And the mortality rates in Utah indicate that almost 78% of individuals who died were 65 and older, and the average age was just over 74 years old. So we know that it should not be a surprise that older adults are at greater risk for severe illness and hospitalization. Some of the big indicators for severe illness were age. And what does that mean? It means the risk for severe illness could result in hospitalization, intensive care, ventilator use, and even death. And nationally, 80% of deaths from COVID were people 65 and older. And so over the past year, we at NCOA have really looked at the impact of COVID on older adults' needs, those living in the community. And the pandemic has impacted everybody's lives, even those who have not had the disease. So our research team put out surveys to community-based organizations who serve older adults to find out what the needs are in their community. And over those 4 surveys, which I'll go through very quickly, we see how they have changed. So in April 2020, folks needed help picking up groceries or meal deliveries. They needed assistance getting masks and gloves and sanitizers, and we all remember the runs on toilet paper. Half of the older adult clients lacked broadband internet access, or they didn't feel comfortable using the internet, or many didn't even own a computer or a laptop or a tablet. In July and similarly in October, folks really were starting to think about feeling isolated, and they had a need for social connectedness. They missed hugging and shaking hands with family and friends. People still lacked access to broadband and still were not feeling comfortable with the internet, the use of the internet. And it was the first surveys that we started to see issues about access to programs to help meet their basic needs, be it food or healthcare and what have you. It was in January, just a few months ago, that we started to see more questions, more information needed about about vaccines, both reliable information as well as how do I get my vaccine? And again, there was still the highest priority of the need for feeling socially connected, because at this point, the pandemic had been going on for 10, 11 months. People were really struggling to afford basic expenses. And again, getting help with technology and transportation. So I think it's important to note that in order to address these changing needs, community-based organizations also had to pivot what they were doing, both because of the pandemic, but also to address the growing needs in their communities. So in April 2020, and this is the same survey, so we asked, what's happening to the people in your community that you serve? And then what are you community-based organizations having to change in order to address those changing needs, but also just because of the pandemic, the impact on your work. So the first thing we found, and this is not a surprise, is that organizations had to suspend services or decrease services, certainly in-person services like the chronic disease self-management classes and senior center classes, and delivering of congregate meals. And many of them pivoted to increasing food and meal delivery to folks in their community. Many services moved to virtual like this and to phone support. And many community-based organizations talked about losing revenue, be it donations or from their municipalities that had to cut back on funding. In July and October of 2020, organizations really talked about how they expanded their virtual reach. They've done more phone support to the folks in their community, and they've really increased their home and delivery services with meals and providing caregiver support and benefits counseling. Organization had to start planning for reopening as allowed by some local health guidelines. And it's not like a flip of the switch that you say, great, we can reopen, let's do it tomorrow. There's a lot of planning that has to go into reopening, from how many people are allowed in to how are we going to keep our center clean so that we aren't spreading infection. And then in January 2021, a lot of organizations, and I know that 5 County has done this, has started to pivot to providing vaccine education and scheduling of vaccines, and some of them even distribution of vaccines within their center. Access to technology for their clients continues to be an increasing barrier. But we know that the community-based organizations have done an incredible job pivoting to meet the needs. I was at a aging conference just last week, or a virtual one, and we asked how are folks feeling about the last 12 months? And many people, just like Carrie said, noted that they really felt like they expanded their reach using technology and other remote options, and also developing new partners in order to really work together to meet the needs in their community. And despite all of these challenges of the past year, there was actually great optimism among the leaders. So here we are looking forward with hope. And I quote that great philosopher of life, George Burns, who said, "I look to the future because that's where I'm going to spend the rest of my life." And we look forward with hope and appreciation. So you all know the FDA has approved emergency use of 3 vaccines in the United States. And scientists and researchers and the drug manufacturers have used research they've already done for a long time for similar coronaviruses, be it SARS and MERS. So they didn't start from scratch. And in fact, it was built on decades of research and experience, and which is how we got these vaccines so quickly. This woman on the right is my 93-year-old mother, who was vaccinated in a local clinic a couple months ago. And she is really thrilled to be able to get out and about a little more. So I see 2021 as a year of optimism and relief. And again, a little more data for you. So, and these again are data I pulled last week. So nationally, we have over 240 million shots in arms as of last week. Over 101 million have been fully vaccinated, and 145 million people have at least 1 shot in the arm. And it's even higher with our 65 and older population. As you see, there are almost 38 million fully vaccinated older adults which is like 69% of the older adult population, which is remarkable. And at least for the 65 and over population, over 45 million people have at least 1 dose of a vaccine, and that's over 82% of the older adult population. In Utah, you'll see that there's been over 2 million shots in the arm as of last week. And people vaccinated, I apologize for the difference in the population of the older adult population. I think Utah data was calculated a little differently, but the 60 to 80 plus population, which is over 21% of the adult population in Utah, you'll see that there's been quite a large proportion have been fully vaccinated. We have over 364,000 older adults have been fully vaccinated, and over 423,000 have at least 1 dose, and really high numbers, high percentages of those populations. I know that in the 5-county area, vaccines for older adults range by county between 50 and 70%. And you might think, well, why is it not higher? And we have a sense of what the problem has been. One is access, and the other is hesitancy. We understand that access to vaccines was an issue initially, but there's certainly more available now, at least in most communities in the country. There were challenges to get an appointment, challenges to get transportation to an appointment, even if you got one. But now they are more and more available in doctor's offices, in community clinics, the VA medical centers, and your local pharmacy. In addition, there's the vaccine hesitancy is also a concern. And for those who are hesitancy, it's important to talk with a trusted medical provider, your doctor, or a pharmacy about those concerns. I know a lot of people are really concerned about how quickly the vaccine came out, and it's important to get questions answered before getting a shot in the arm. But these vaccines are free. There are no out-of-pocket costs. So per Kate's message, if somebody tries to say, well, you got to pay first, you know that that is a fraud, that you shouldn't have to pay anything to get your vaccine. And as we increase vaccinations, it leads to less disease in your community and among your family. Once vaccinated, there'll be more opportunity to be outside and see your family and friends and enjoy the beauty in your region. Next week, my mom will be able to see her children and her grandchildren and great-grandchildren all together for the first time since my dad died, because we know we are all more protected now and won't be exposing her to severe illness. So we're having a small gathering to support my mom and honor my dad who died this year. For those who are concerned that, well, we know that these vaccines sort of did well in clinical trials, but what about the real world? Well, there's really good news about that as well. Recently, there was a multi-state network of US hospitals that had been studying hospitalizations from January through March of this year for folks who received either the Pfizer or the Moderna vaccines. And what it showed is they are 94% effective against hospitalization among fully vaccinated older adults. Similar studies out of Israel and out of the United Kingdom showed reduced risk of hospitalization or severe disease for all adults. Okay, so we're aging well beyond COVID. The good news is that just like the cicadas come and go, so do pandemics. And like cicadas, we are beginning to emerge out of our tunnels, but we call them homes. And when we do, you may be thinking, well, what's next? We all want to live out our later years healthy and independent, but sometimes it is a struggle. I was listening to a talk just yesterday, and the speaker made the point that none of us are ever truly independent. From the time we are born, we rely on others. We are interdependent beings from the beginning of our life to death. And our need for help and support is lifelong. If you or someone you know is having some struggles, whether it's with money or health concerns or even stress, you should know that there's help out there and it's not far away. Your local area agency on aging, be it 5 County or somewhere else, or other community-based organizations, are always here to help. Over 15 million older adults, 65 and older, are actually economically insecure. They struggle with rising housing and healthcare costs, inadequate nutrition, lack of transportation access. There are public and private, Did I freeze?
You can still.
You can sit, well, I think I went. Hold on one second. Oh, wrong way. There we go. Sorry about that. There are public and private programs available to older adults to help pay for health care and prescriptions and food and utilities and more. And yet, why is that happening? I'm sorry. There are there are programs, but millions of older adults are missing out on core programs to help them bathe. So there seems to be, and I apologize, it's jumping ahead and I'm not sure how to stop that. Okay, if there's a tech person on, it seems to be jumping. There are programs out there that help meet your basic needs. Let's see, I am going to stop for a second and just see if I can stop this. Let's stop. I apologize. I don't know why that is happening. I'm going to stop the share for a second. Let's stop the share. I apologize. And let's see if I can. I'm going to stop presentation. Let's go to the slideshow from the beginning. And okay, let's see if that. So I think I stopped my share. So what I want to do is okay, I am going to, you probably can't see it, right?
No, not yet.
Okay, I apologize. I have to, I've never had this problem. Okay, so let me go back to the presentation. And where are we? I think I might have to. Oh, crap. Okay, I'm back. I am really sorry.
Isn't technology fun sometimes?
Yep. Share. We're going to share it. We are back. And I am going to go to my current slide. Let's see if this works. That was very strange, and I really apologize. So I didn't want to use up all that time. So just to let you know that there are benefits available. About 48% of older adults, it's happening again, are not eligible.
This is what it wants to do, just go with it.
Okay, so I want to say that 5 County has helped over 1,000 clients apply for benefits. They've helped with over $11 million worth of benefits that they've applied for through Medicare Part D extra help, energy assistance, SNAP, food assistance, Medicaid, veterans benefits, and tax benefits. They've done an amazing job helping older adults in their community. So I do want you all to know that just announced is a new broadband benefit. Applications are beginning on May 12th, and this was announced by the FCC. Folks can get temporary discounts for their broadband service, $50 a month for most people. And if you live on tribal land, $75. Applications begin on May 12th, and there's information on how to apply and who qualifies, but my guess is your local AAA, 5 counties or others will be able to help you apply. In addition, given what we talked about, the managing about chronic disease and the risk, especially if you get COVID, you all may not know that there are special classes called Managing Chronic Conditions, and in Utah, it's called Living Well, on ways to manage your chronic condition, be it diabetes or pain or something else. And living well with a chronic disease can really help you. These classes can help you improve your quality and your years of healthy life. I know that virtual classes are now available, but in-person classes might start soon. And my understanding is one of the breakout sessions in a few minutes will actually be on living well with chronic disease. I think it's focused on pain. So as we come out of our homes, and we may sing like cicadas, but we really want to reconnect with the folks that are important to us. Our lives do not happen in isolation. Human connections are vital, and nearly every aspect of our lives, from the mundane, like going grocery shopping or getting gas, to getting prescriptions, to the more profound, like attending a wedding or other life events, relies on really being interconnected with other individuals. And the experiences that we have interacting with others leave an imprint on our lives and shapes who we are. Yet over the past year, many people have lived in isolation or semi-isolation due to the COVID-19 pandemic. And we've talked about how it's really been a challenge to connect with one another in meaningful ways. And while we've all gotten creative about finding ways to stay in touch, from talking to one another through windows or having video connections like this one, or talking on the phone just more often, there is really no substitute for direct human interaction. Pandemic fatigue is real. Even with vaccine availability opening the door to more normal interactions, many are struggling with how to reconnect after a year of so many challenges and changes. And gratitude offers a way to reconnect with our family, with our friends, and with our communities. Why gratitude? Well, for one reason, being grateful for another person automatically means remembering that we are social beings and that we need each other. It reconnects us instantly to one another and the world around us. And so my question for you is, what is important to you? Is it a certain person or people or your family? Is it places that you love to go or opportunities you didn't take? Is it singing in a choir or playing in your regular bridge game, or a walk in the park with a friend? And so when the cicadas emerge in 2038, what will they have missed for 17 years? And what will they find? My wish is a society of hope and health and financial security and caring for all older adults. And maybe then we too will all be singing loudly. Thank you.
Thanks so much, Leslie. As someone who's lived in the Western US my entire life, that was really cool to learn about, and it was such a great reminder of the wonders of nature. So thank you for that beautiful example and the great information and resources. I think we'll all be thinking about what we want to see over these next 17 years. We appreciate you taking the time to be here with us today, and we look forward to our continued partnership and hopefully having you here in Utah in person sometime.
Oh, I would love it. I love Southern Utah, and thank you. And I apologize for my little problem, but thank you for being so flexible.
No problem. We have all been there with technology over this last year. We've had our shares of ups and downs and battles, so I think we're all used to it. Okay, everyone. So sitting for about an hour, I think it's time to get up and move a bit. We'll take the next 5 minutes to have a break, so please feel free to get up and do whatever you may need to, but if you'd rather stay with us, We put together a short video with a sampling of stretches from the Arthritis Exercise Foundation Program for you to try out. If you like this activity, there will be information at the end of the video on how to participate in a full class near you.
Hi, I'm Maria, Director of RSVP with 5 counties, and I'm here to share some of our exercises through the Arthritis Foundation Exercise Program. These exercises can be performed sitting or standing. The purpose is to increase flexibility and range of motion. They're performed in slow, controlled, and pain-free movements. So let's get started. So we're going to start with the head turn. So you turn your head to the side as far as you can without it being painful. Hold for the count of 3 and back to center. Go to the other side. Hold for the count of 3 and back to center. We're going to go ahead and do that 3 times. Center and back to center. 2 more times. That exercise just gets you moving. Now we're going to do the shoulder shrug. So bring your shoulders up to your ears and hold them for the count of 3 and then drop them. Bring them back up to your ears and drop them. 1 more time. While you're doing these exercises, make sure that you breathe. So now we're going to do the forward arm reach. I'm going to show you this sitting down so that you can understand that you can do these sitting down or standing. So forward arm reaches, bring your arms up as far forward as you can. Another way to do this is you can bring opposite arms like you're walking, but feel the stretch. Okay, let's do that 5 times each. 2, 3, 4, and 5. Okay, so another exercise, and this can be done sitting down or standing, is to reach for the apple. So you go ahead and we'll do that standing up. Take your arm and go diagonally across your body and look at that apple. Grab it and reach it. Okay, bring your arm slowly back down. Other side. Reach for that apple. Look at it as you're reaching for it. Can you feel that stretch? And back down. Let's do that 2 more times each side. Very good. Okay, one other really good exercise that we use for warming up in some of our other programs is marching. So you can do this sitting down or you can do it standing. If you're sitting, just go ahead and march in place. It's that simple. You're watching TV, go ahead and do a little bit of marching. It's a good warm-up exercise. Okay, and while we're sitting, we're going to go ahead and do some abdomen. So bring yourself forward on the seat where you're comfortably on the edge, but not unbalanced. Arms across your chest and lower yourself to the back, just gently. Tuck your tummy in and bring yourself up slowly. Abdomen exercises can be that easy. Let's do that 2 more times. And remember to breathe. How does that body feel? Shake it out. Those are just some of the exercises that are available through our Arthritis Foundation Exercise Program.
All right, thank you everyone for stretching with us, and we're going to go ahead now and get moving into our breakout sessions. So if you filled out our survey and pre-registered for our breakout session, then as soon as we open those rooms, you are automatically going to move into that breakout room. If you didn't pre-select a breakout room, as soon as we open those rooms, there's going to be a box that pops up, and then you can choose which breakout session you want. We do have 3 breakout sessions today. We have, is it a magic lamp or just a scam? We have soaring through life with less pain. And we also have a whole new world of technology. Just drew a blank on that breakout session there. So we are going to go ahead and move into those breakout sessions automatically right now. Those sessions are going to close and bring everybody back into the main room. So if you're having issues, our staff will be available to help you choose a breakout room. But we really hope you enjoy this customized presentations and you can get some really great information from those breakout sessions.
All righty. Thank you so much. I'm not going to take a lot of time and we're just going to kind of close things out, but I think, there were some amazing presentations. I was excited to hear from them. I wish I could have been in all of them, but the good news is they will be available on our YouTube channel sometime within the next week or so, as Amy is able to get those put onto our YouTube channel. But so if you've missed a presentation, feel free to check back in a week or so on our YouTube channel. And you can see those other presentations. So, but I once again want to thank our keynote, Leslie Freed, with the Senior Director for Centers of Benefit Access with the National Council on Aging. We want to thank Kate Nance and her great game with Adult Protective Services and the Division of Aging and Adult Services, as well as Jason Sturzer and Darren Houghton. Rebby with Intermountain on her self-management, and then last but not least, Madeline, the co-founder of Mona Me, and her presentation on senior technology and sharing with us how she connected with her grandma and given us lots of great resources to help us connect with those we love. And again, I'm amazed every year how much I learn, and we want to thank all of our sponsors as well. At the end, there'll be a little blip that will come up that will show all of our great sponsors. As we close out this year's conference, I just wanted to touch on the services and resources that are available to older adults, caregivers, and professionals through our Area Agency on Aging here at 5 County, as well as our local senior centers and our community partners. So even when the senior centers were closed for in-person services over this past year, they continued to provide essential services such as home delivered meals, curbside pickup meals, transportation, shopping, help with picking up and delivering of essential items and groceries for those who didn't have other options, as well as prescription and picking up people's mail. A lot of services that they adapted to during the pandemic to help our seniors, providing telephone reassurance, socialization, and other services. Now that the centers are starting to reopen, they're starting to do some more in-person services. That's going to vary by center as they're slowly opening up, but they hopefully will be soon starting some of the congregate meals. We will be encouraging people to reach out and participate in those services. Again, we're looking forward to continuing to offer virtual services as well as in-person services as we move forward. And we also encourage people to reach out. Many of our senior centers, with this being closer to last year, are short staffed. They're working to get staff hired. They are short on volunteers, as volunteers have not been coming into the center. So if you're willing and able, please reach out and volunteer at a center, helping them to get services back in place, helping them to reach individuals who have been isolated over this past year. We also want to recognize the importance of ensuring your health and well-being. So the centers are looking at safety precautions and procedures, and so we ask you to just be considerate of them as they work through that to make sure that all seniors are safe as they start working back into that in-person services. Here at 5 County, again, we will also start looking at options for in-person service delivery, doing that in a safe manner, along with continuing to offer a variety of virtual services. You can see there on the screen, we've got some great things coming up that will be available both virtually and in person. You can reach that and access that information through our website, through our social media pages, or just contact us directly and we'll connect you with someone. We have, you saw a little blip about our Arthritis Foundation Exercise Program that Maria showed you some of those exercises. That's going to start happening more and more in person at some of our centers. We have our Dealing with Dementia. I'm a Caregiver, Dementia Dialogues, Caregiver Academy. Again, right now, many of those are going on virtually. We have some classes starting soon. And then hopefully in the near future, we can start doing some more in person there. We have our Tai Chi going on different places, chronic disease, which you heard from Rebby, those that were in her session about our chronic conditions classes, both chronic pain, chronic disease, and diabetes. We also have a Walk with Ease. And right now we're in the middle of a Walk with Ease challenge where teams are walking each week and tracking their miles. And so we're going to be doing more of those type of things to get people involved and interactive. So we really, again, encourage you to stay involved, whether that be virtual or in person and at your comfort level. So we also, again, I talked about encouraging you to visit our website. We have our social media pages, our YouTube, we have a Pinterest page. We have a special caregiver Facebook page that is a closed caregiver page for caregivers. We've left that closed so that caregivers could feel comfortable just talking to each other in a more private setting. But if you're interested in being a part of that, you can reach out and ask to be invited to that caregiver page. They have great information. We have daily posts and educational information going on there. We're going to be having some upcoming webinars in the next few weeks and months. So we, again, encourage you to reach out. The other thing we're looking at working with our other AAAs across the state and with our State Unit on Aging and our Utah Commission on Aging is a statewide calendar. We're working with Madeline with Monami and helping us develop that statewide calendar. That will enable you as people, as seniors in 5 County, if there's not something available here, if there's something virtually available in another area of the state, you can be able to access those services. You can look on that statewide calendar and you can participate in an activity in another area of the state. So we're hoping to make things more interactive, more available, more accessible to seniors, not only in our local area, but across the state. Rob Entz with the Utah Commission on Aging is working with a special senior call line. And so we're very excited with the things that are happening. And we encourage you to just reach out with us, to talk to us, to find out what's going on and to be active participants in senior services within your communities. So again, thank you for your participation in this conference. Again, we look forward to hopefully having one in person next year. And as we talked about, we'll still be providing virtual options as well. So thanks again for your participation and we'll see you, well, next year for some of you, but hopefully we'll see many of you at your senior centers, at our programs and services in the upcoming months. So take care. Bye-bye.